Before we start, here are some remarks from Elizabeth Giannini, Senior Vice President of Government Relations at DentaQuest, the sponsor of this Politico Live program.
Good afternoon, and thank you for joining this important conversation on the very real and growing racial and economic disparities within the oral healthcare system in the United States, and what those disparities mean for the overall health of our nation. I am Elizabeth Giannini, Senior Vice President of Government Relations at DentaQuest, and Politico's proud partner today. While many of us don't think twice about visiting the dentist for preventative care like cleanings and routine procedures, more than 74 million Americans lack basic access to coverage. And that was before the COVID-19 pandemic upended our economy, leaving millions more without jobs and healthcare benefits. Sadly, lack of access is just the beginning of the story. In this country, Black adults are nearly 70% more likely than white adults to have unmet dental needs, and that has a very real impact on overall health. Poor oral health increases risks, costs, and worsens outcomes for far too many chronic diseases, including diabetes, asthma, hypertension, and depression. Today, we'll hear from a panel of healthcare experts that will examine real solutions to address these inequities and how to build a better system. For example, in order to effectively make transformation, we must first address the fact that in 14 states, Medicaid fails to provide access to comprehensive dental benefits for low-income adults, and a recent CMS rule will make it easier for states to cut those benefits. Likewise, Medicare does not cover dental care at all, leaving 44 million seniors nationwide without access to benefits. These inequities have very real consequences for far too many people. Thanks to the John C. Burr Foundation, we have the opportunity to hear directly from those most impacted in a short film. They have given us permission to share it with you today.
When you look at somebody, you talk to somebody, the first thing you look at is their teeth.
There are millions, tens of millions of Americans every day, every year who don't have access to the oral health care that they need.
We don't have anyone to go to typically because we don't have dental insurance.
When I got out of the Army, I didn't really took care of my teeth like I should have been because I had other things in my mind, and of course I didn't have dental insurance to take care of it.
I see patients every day that haven't been to the dentist in 30, 40 years.
We had a 3-year-old yesterday actually who walked 2 miles to come to our office because the mom could not find transportation.
You do anything you can to not have a tooth pulled. But when you're also raising a family, it's a no-brainer to have the tooth pulled. And that's the way it's gone.
It puts you in a different class. It puts you in a closet.
If you have to live with chronic infection, with chronic pain, even your diet is changed because you can't bear to eat such and such.
Poor oral health can be directly related to poor overall systemic health, creating higher risk for respiratory infections, heart attack, stroke, and an uncontrolled diabetic status.
As a country, we are never going to volunteer our way out of this access to oral health care crisis. The only real solution for addressing this phenomenal unmet need is systemic change.
Stories like these are why we need major changes. The DentaQuest Partnership for Oral Health Advancement has worked with more than 110 leaders to create a new model that will improve oral health and the overall health for everyone. This new approach, called the 3-Domain Framework, emphasizes the integration of medical and dental care, better use of teledentistry to increase access and reduce costs, and prevention through minimally invasive care to address issues before they require costly surgical interventions. State and federal leaders, as well as healthcare industry experts, must be catalysts for this kind of change if we are to achieve healthier communities. Together, we can make change. Thank you, each of you, for being at the forefront of critical conversations like the one we get to hear today. Now, I'll turn it back to Adrielle for what I know will be an informative and action-oriented discussion closing this devastating gap in care.